Lynn, can you hear us?
I can.
All right, awesome. Great. Good afternoon, everyone. Lynn may have to keep letting some people in, so you'll keep hearing the doorbell. But since it's 3:04, I wanted to get started. We did have one brave soul come out to meet with us. So Kim is in the room with us, but the rest of you are on screen. So I want to say good afternoon to everyone and welcome. We're excited to have you here as new board members, elected officials, benefit clerks, and bookkeepers. Today, we'll be diving into what membership in the Municipal Health Insurance Consortium means. We have started using a more condensed name, probably from when we did our initial presentation to you. We have a new logo that better reflects our comprehensive and collaborative membership. Our goal today is to make sure you leave with a clear understanding of who we are, how we operate, and how we support your organization. We've structured today's session, you can go to the next slide, into 4 key areas. The agenda looks scary, but it's really 4 key areas. A consortium overview, what we do and why we exist, and your new role as a member. We'll then switch gears for billing and how to pay an invoice. Jen Sandstead to my far left. We'll talk about that. And yes, we do things differently, which I'm sure some of you have already learned. And then to my immediate left, Kylie Rodriguez, our benefits manager, will talk about health insurance overview for benefit clerks. Everyone is welcome to stay for this section, but it will dive down into the weeds, especially when we get into enrollment changes, how to make updates smoothly and accurately. Also with us today is Lynn Sheldon, our clerk of the board on screen. And to my right, your left, is Jess Molesky, our benefits coordinator specialist. We're going to pause halfway through the presentation for any questions, but also if anyone wants to stop at that point, but all are welcome to stay for the full 2 hours if we make it that long. I'll start kicking us off by saying as we move forward, remember what Helen Keller said, alone we can do so little, together we can do so much. Which is what our mission is all about. It was about coming together as municipalities in an intermunicipal cooperative to provide high quality, cost-stable health insurance for our members, their employees, and retirees. We had this vision. We were shifting the paradigm of how municipalities purchased insurance by forming the consortium. So we collaborated with other administrators, providers, in a way to help you control costs and for us to be efficient and successful in this adventure together. We want it to be really transparent, trustworthy, efficient, and model kind of this new health insurance paradigm, and to educate our members more directly on their own personal health, which we do through our 3rd bullet point by promoting a culture of preventative healthcare and wellness. We are really a unique bunch. We talk a lot about New York Insurance Article 47. That's what governs us. We're governed under New York State insurance law. We're much different than just going out and purchasing insurance from Excelis or United or MVP. It's a whole different ballgame. We aren't Excelis. We look a lot like them, and we'll talk about that, talk about why in a second. But our our organization has a lot of rules and regulations under the municipal cooperative health benefits plan agreements. We're designed to provide health benefits just to public employees, and we're governed by very specific legal requirements. We have a certificate of authority from the New York State Department of Financial Services, and it spells out our conditions. Each year, you're asked to sign a municipal cooperative agreement, but that's part of being in Article 47. Those must be in place and approved by DFS. We have to establish reserves and surplus requirements, stop loss requirements, contingent liability, and more. These provisions ensure that the municipal cooperative health benefit plan is maintained in accordance with law. And oftentimes you will hear me complain about some of the requirements and the hoops we have to jump through, but it allows us to do what we do. So there are a few things that are unique about an Article 47 cooperative. What's unique about us is we are the largest Article 47 of our kind in the state of New York. There are no other municipalities that have band together like us. The other Article 47s are school districts, so we're really unique. But we have to adhere to the same Article 47. So like I've already said, we're governed by the New York State Department of Financial Services. Even though we're all individuals, we're considered one self-insured community. So we're self-funded, we're self-insured insurance organization. You are owners, and we write our own benefit plans together. We do mirror what's in the market, but there are plans that are approved by the Department of Financial Services. We must put into our plans any New York State mandates. And the other things that we talked about just a second ago, we have to adopt the MCA, establish our reserves. But what's unique to us is we have voting seats on our governing board for every single municipal member, but also a role of labor in our governance structure. And we'll go into a little more details on that. If you were considered a small municipality, or a small community rated plan, you are now considered a large group health insurance coverage when it comes to Medicare. So Medicare becomes secondary if you have active working employees that are currently enrolled in Medicare. So we pay first, then Medicare comes in later. Not the case if you're retired and older than age 65. So that's something unique to us. And also we have to offer COBRA for 36 months. Regular plans only 18 months, most plans only 18 months, but we have to offer it for 36. Now, nobody stays on COBRA for 36 months because it's cost prohibitive, but we do have to offer it. And we'll talk about how we assist you with COBRA administration if you're a municipality with less than 50 employees. Our membership has grown significantly. For those of you who don't recall, probably my first presentation to you, we started in Tompkins County. That's why our name was Greater Tompkins County. It then moved into the 6 contiguous counties. Then we grew into 10 more counties. We're now in 18 counties as of last year when we added Livingston and Monroe. So in 26, we will have 87 municipal partners and over 8,500 covered lives. These are all our municipal partners. So if you want to look at the list and see who you might know that's on this list, or who you might know who's not on the list, because you become our best advocate going forward. But those of you highlighted in the darker color are our new 2026 members. So welcome. So what are your expectations as a municipal member? I just want to let you know that way back when I joined the consortium, one of the reasons we had a really hard time recruiting new members is because we had 6 board meetings a year and required people to attend committee meetings. And so I would go out and do presentations and people would say, we're not really interested. We don't have enough time to be a member of your organization. So we've changed a lot of that, but we do request that you make yourself present at very specific things. So the first 2 are for board members. We have an annual education session in August where we talk about all of the plan changes, premiums, everything like that in August. And then we vote on all of the changes at our annual board meeting in September. So those are really the 2 required meetings that we're asking you to attend, to be a participant in the consortium. The Joint Committee is a committee that is part of our municipal cooperative agreement required under Article 47 that labor have a role in the organization. We'll talk a little bit more about the Joint Committee and their role, but they meet 4 times a year. You have labor representatives on that, but you also have 1 municipal management member that sits on that. I think Lynn's been harassing people to make sure we know who your Joint Committee members are. And then we ask that your benefit clerks or whoever is administering your benefits and communicating to your employees come to those benefit clerk trainings because that's where they learn what's going on. And you are the ones that communicate benefits to your employees. So it's the best way to know what you're rolling out. We did have some municipalities call us recently within the last week, maybe even yesterday, and say, hey, can you tell me how my plan changed? Because their employer did not roll it out to them. I sent them the link to the benefit clerk training with all of the information. It would have been great if they had come to it and been able to ask Kylie and Jess questions as we were rolling out. So those are very important in helping you communicate with your employees about what's going on with us. And then under the insurance plan part of it, 1, you must host an open enrollment every year. That allows all eligible employees an opportunity to make changes to their coverage. That's the 1 time a year, unless they have a qualifying event like getting married, that they can change their coverage. So you can't change your coverage month to month. You can only change it once a year at an open enrollment time. And that's usually done in November for changes that are effective January 1st. And it's when people can drop plans and pick up the plans if they didn't have it previously. The other insurance requirement is that you notify your employees when leaving coverage that they are eligible for COBRA. And we'll talk a little bit more about that later. And then there are 2 things, like I said, Lynn's going to keep nagging you. We don't like this any more than you don't like it. Every year, we're going to ask you to sign a new municipal cooperative agreement, usually by December 1st. You have to send it in with supporting resolution, signature page. Unless you were a new member this year, you have not signed the MCA yet because DFS hasn't approved it yet. So we go through this every year waiting for DFS. Then we send it out and say, please sign it really quickly because we have to send all the paperwork back to DFS. So it seems like you do this constantly. And I have to agree with you. It does feel like we're doing it constantly, but it's part of remaining under that certificate of authority with DFS. The other thing, also something we're audited on by DFS is making sure that directors and alternate directors sign a code of ethics annually. We're kind of holding off on that, hoping we can send it with the MCA. But if you don't, if the new MCA isn't approved, we'll start sending that out shortly to get that back to us within March. How are we governed? This is our org chart. It's really straightforward. We have the board of directors at the top, and all of you have one representative, regardless of size, on the board of directors. So you really own and operate this organization, but we don't leave you in the dark. We have staff members to help support you and provide the administration to keep this organization moving forward. Also moving forward, when the board is not in session, the executive committee operates like the board to keep things moving forward when not in session. So the executive committee will be monthly. They're elected by the board. And you'll see updated resolutions and other policies and significant events communicated out through newsletter or through a special email through our clerk of the board. And that's how we'll communicate what the executive committee is up to. But drop in on those meetings anytime you wish. On the far left of the committee line is the joint committee. And as I said, there's municipal management members on the joint committee, as well as a seat for each collective bargaining unit. The joint committee elects 10 representatives from the labor members to sit on our board of directors. So even though we have 87 members, we actually have 97 seats on the board because we have 10 additional labor representatives on the board. The rest are volunteer committees. I'll talk about them in a second. But effectiveness and efficiency, especially when it comes to money, is how we want to operate. So the section in green at the bottom, we only purchase those services when we need them to keep our overhead down. And then we outsource provider network and claims adjudication, the paying of the claims, to our third-party benefits administrator. And right now that's Excelis. They do both the medical side and the prescription drug side. And that's our organization. So I talked a little bit about the municipal cooperative agreement. Already mentioned has to be signed and approved by resolution when you join, but then any time a change is made, we add new members every year. So we have to send it out every year that every municipality is accepting those new members. So that's why we do it annually. We don't always change the context of the MCA, but new members forces us to send that out. As I kind of mentioned earlier, DFS is very specific about the process. They want the signature line sent a certain way. They want your resolutions sent a certain way. They want the MCA to look a certain way. So if Lynn gets back to you and says, can you please send this back? Please know it's not us. We're doing what the Department of Financial Services is asking us to do. We could blame Lynn, but we'll blame it on DFS. As I mentioned earlier, we used to make our board members come to a lot of board meetings and a lot of committee meetings. but the required municipal representation is the attendance at the board meeting. If you are elected to the executive committee, excuse me, required to attend that as well. But that's only if you're elected. And then the joint committee. So those are the required meetings and events. Optional, if you want to get more involved, and a lot of people want to get more involved because this is your organization. We're lucky to be stewards of it, but it's your entity, and if changes are needed to be made, they're made by you, and they start at the committee level. So we have audit committees, very exciting, meets once a year. Claims and appeals, finance committee, nominations and engagement, and the operations committee. Operations is more the policies and procedures, where new ideas come out of and from, has a lot of the administrative representatives from our municipalities, not so much the board members, but they're where the rubber hits the road and share a lot of their experience with us. So anytime you want to get more involved, there's a ton of opportunity for that. The board of directors' role and responsibility is spelled out in Article 47. They must approve the annual budget each year, and the annual budget includes our premium rate increases. In addition to that, the board must accept new members, approve any new benefit plans or plan design changes. For example, last year, due to the actuarial value, calculations, which were also required by insurance law, we had some benefit plan changes, and they must be approved by the whole membership. You also elect your officers and your executive committee. It's your job to ensure the fiscal soundness and prudent operation of the organization. We encourage you to communicate back to your legislative bodies of what's going on, because they, in a sense, own us. And like I said, we encourage you to become more involved at the committee level and attend those meetings in August and September. Here are the dates on the right-hand side. I believe Lynn already, did you send out invitations for these yet to all board of director members? You should have received those invitations already.
Yeah.
So you can reserve those dates on your calendar. I'm happy to report this year, I will not have to attend any annual meeting on my birthday. I'll be able to relax and enjoy my birthday this year. So the joint committee, what they end up doing, we've already talked about who the membership is. They're going to review the recommendations. We come with market data regarding benefit plan design changes. So they're looking at those changes, they're making comments, making sure we're remaining competitive, making sure we're adding value to our members, and that we stay in compliance right now with the Affordable Care Act. They are the ones that kind of have the final plan change recommendations to the board. It stops there usually last before it goes to the board. And then the board is who approves those plan changes, and then we notify the municipal partners. We coordinate those changes with Excelis, and then, like I said before, they're usually effective January 1st. The other key role the joint committee plays is with our wellness program. We'll hear more about the wellness program later, but they focus on topics. They look at our utilization, our claims experience, and focus on topics that are applicable based on that data. And then, because we want everybody to have fun with wellness and get involved, they also suggest wellness challenges, wellness prizes, and things like that. There's speculation right now that one of the next prizes to participate in wellness is going to be one of those aura rings measuring all your moves. So Big Brother's gonna become part of wellness program. Just kidding, just kidding. And then our committees, I'm not gonna go into detail. I think they're pretty self-explanatory, but Lynn will send out this after today. And so you can look these up and see where you might want to be involved. I'm going to turn it over to Kylie for a little bit so I can take a rest. Oh, not yet though. Because this slide is all about Kylie. One of the things we say is we have a little secret weapon, and it used to just be Kylie, but now we have a benefits department. So it's our benefits department, Kylie and Jess. I like to say all our staff are secret weapons in their own little area of arsenal. But customer service is a little unique and a little bit different for the consortium. We have with our third-party benefit administrator, Excelis, our own customer service line. This is a group of customer service specialists who know the consortium and know that we're unique and know that we're self-funded and know that we're different and give out information specifically about the consortium and not just generic Excelis plans. So we always ask employees to call that 877 number first to get information on how your claim is processing. What is the information you don't understand, you need to know, because if you still have a question, you can email HC Benefits and someone on the team will get back to you right away, or call our information hotline for a lot more customer service, problem resolution, troubleshooting. And that's where I say, our secret weapon comes in, is helping your employees understand their benefit coverage better. Even if you get turned down on a claim, if we can't get that claim paid, at least you understand why it was paid the way it was, rather than just someone on the phone saying, nope, not covered under your benefits, explaining not only why it was paid, but how it might be able to be paid in the future. For example, a prescription drug that requires a prior authorization, walking you through what prior authorization looks like, what you can do as a member, but also how your provider can participate in that prior authorization. We call providers on behalf of members, not every day, but we have gotten involved if a member has asked us to communicate more effectively with their provider about their health insurance. We also have a ton of information on our website, which Kylie will talk about later, but also at the bottom of this page, you all have your own custom landing page on our website. And it has your summary plan descriptions on it, your application, and a lot of other information specific to you. So it's not just, going on some massive thing, you can dive right into your municipality. There's also a lot of training on the website as well. I spoke about that a little bit earlier. The other thing that comes up a lot when we're doing new member orientation is I'm losing my broker. You don't allow me to pay broker commission through you. Therefore, I'm going to lose my broker. I need help with X, Y, and Z. This is the additional stuff that we can help you with that your broker might have been doing in the past. Talking about eligibility and enrollment assistance. We'll have more training on that coming up. Medicare transitions. We have a Medicare expert on our team, Kylie, who can help with Hey, my spouse is going on Medicare, but I'm still on this plan. Hey, I'm looking at 3 different plans. What does this mean to me? What do I have to do now? What do I have to do later? Hey, I'm 65, but I'm still working. Do I have to sign up for Medicare? We'll go through all of those on an individual basis, but we will also come out and talk to your retirees about that as well. Our presentations have been stolen, asked permission from other organizations that are competitors to ours because our material is so good. So that's something we provide. We'll do plan comparisons for you at any time. If you're looking at some new plan in the market, you want to know how your plan compares to it, we'll compare to, a Teamsters plan, another plan, a United plan, an MVP plan that's out in the market. But also, if you are coming up with a new benefit plan strategy, we'll strategize with you. We'll do plan comparisons. Hey, you might be on some old indemnity plan right now and you're considering platinum, or you want to know if a platinum is different than gold. We will walk through you with that. We'll do a health plan review with you every year. And as I said earlier, we're there for education. We'll do your open enrollment. We'll do your retiree education. We want your employees to have support on having better informed benefit decisions. Kylie and Jess don't like to brag about themselves, so they let me do this screen because I really think this is what sets us apart from some other organizations. Now I'll turn it over to Kylie.
Oh, it's my turn.
Yeah.
Okay. So part of the joint committee is they provide us feedback for constructing our consortium wellness program. We actually have a wellness calendar that we put in front of the joint committee for approval every year. And we're kind of kicking that off this year with a whole bunch of new programs and information and some new speakers this year for our webinar. So it's going to be a great year for our wellness program. Everyone on the call has automatically been subscribed to our wellness emails and our quarterly newsletter. Just a heads up, you should be seeing, if you haven't already, you'll see one coming out at the beginning of February with the expectation that the benefit clerks will then pass that information on to their subscribers and on to their employees to encourage participation in the wellness programs. We run challenges that includes prizes. We also host different guest speakers for webinars. Coming up in February, we're going to have a professional come in, a doctor come in and talk about menopause 101. It was one of the topics that we were asked to bring in a speaker on. We also started last year a wellness book club that is hosted twice a year. It's a virtual book club. It's actually a lot of fun. And you get a free book out of it by registering. So all that information will be rolling out into the wellness emails. So we encourage you to encourage your staff to participate. Healthier staff means less sick days, of course, but it also means a happier staff. So just thinking about wellness in your workplace. We also host annual Blue for You clinics, which is a fasting blood draw. We have clinic locations confirmed in Ithaca, Portland, Dryden, Romulus, Waterloo, Elmira. I think I covered them all right. Yeah. Okay. All over the place. And they're open to anyone enrolled in our meta level plans, to the subscriber and their spouse or domestic partner. They can participate for free. And it allows them an opportunity to get a fasting blood draw done and kind of get to know their numbers, get to know their health numbers. We see a lot of subscribers who don't regularly go to a primary care doctor and get that annual blood draw. So some of it can be very eye-opening to where they stand for their health right now and their wellness right now. Those registration kicks off at the beginning of February, and we run clinics all over the place, as I said, through February and March. So just a great opportunity to promote that with your staff. In the wellness email, there'll be flyers about the clinics as well and how to register. There's also other information about Excelis programs like Blue 365. WellFrame is a great program. which gives people free access to dietitians, nurses, get support for chronic conditions. Even weight loss programs are involved in WellFrame. So there's lots of great resources out there, and we'll continue to push out that education material throughout the year. And our hope is you will support us in doing that as well. Promote people registering to get the wellness email directly, promote them participating in a challenge. We have some offices at municipalities where they challenge each other in the office to participate. So just creating that teamwork environment. We are also, our wellness program is our focus on our Facebook page and Instagram. We'd encourage you to follow us. That is a great way to get extra information about the topics we focus on in our wellness program, where we post videos, articles, all sorts of stuff there as well. So definitely worth looking into our wellness program. So ancillary benefits, just by being a consortium member, you have access to other programs. So Canna RX is a program that anyone enrolled in a consortium plan has access to. Canna RX is not extra insurance. It's a voluntary prescription drug program where if someone's on a name brand medication, I would encourage them to go on the Canna RX website and look it up. Because if their medication is covered under Canna RX, they can be shipped a 90-day supply to their door for zero copay. How it works is Canna RX offers the consortium lower drug costs. So in turn, those drugs are zero copay to our members. This is a great way for us to reduce our claims amount, for our members to not incur copays for medication. And that one of the greatest advantages is if your members are on a high deductible health plan, they can get their medications for free and it not be using their HRA or HSA cards to pay for their medications. I've seen great success with medications like Eliquis. On average, this drug costs around $500 a month at a retail pharmacy, as well as inhalers, rescue inhalers, maintenance inhalers. The only thing that they really don't do is anything that's temperature controlled. So no insulins or GLP-1s or things like that, but their drug list is extensive. The other comment I normally get from members is, I'm not on any medications right now, so I'm not going to worry about it. That's fine, but it's great to have the information for when you go and talk to your primary doctor and they start rattling off drug names and you're like, I have no idea how much this is going to cost me. So just a great resource to have, and it's available to all of our members. So a subscriber, their dependent, their spouse, all has access to this. One of the other services that's included in being a consortium member, we found several years ago now, that a lot of our small group, our 50 or below municipalities, their benefit clerks are not just running enrollment forms every other day. They're also, giving out marriage license, working on budgets. They're very busy. And what we were finding is that COBRA administration has very particular timing rules for issuing out notices, especially when you term off of coverage or when you enroll in coverage. And those notices weren't being sent out in a timely manner or weren't being sent out at all. So in order to counteract it not being done, the consortium took it upon itself to offer that service to any of our small group. So all of our small group, which means 50 or less, are enrolled in this program automatically when you join the consortium. And what it is we contract with Lifetime Benefit Solutions to make sure that everyone's getting their COBRA notice when they enroll in health insurance. When they're turned off of coverage, they receive a COBRA offer letter where they can elect to enroll in COBRA or not. If they elect to enroll, LBS handles the enrollment, and then will collect payments from the member who's enrolled in COBRA. Those payments are then paid back to the small group municipality to offset the billing you're going to be getting from the consortium. Of course, if you ever have a COBRA enrollee, we can walk you through that whole process. But just know that those notices are being handled by the consortium and that you don't need to enroll your members or creating COBRA offer letters or anything like that if you're a small group municipality. We do expect our large group to handle their COBRA administration on their own, which they typically do a really great job at, but Our small group is busy multitasking 100 things, so this is one thing off your plate. So then the question I always get is, well, how do I know if I'm a small group? I made a list. So all those in gold are new municipalities that are joining the consortium. And then all the others are existing small groups. There's 2 pages. I couldn't fit them all in one. So there's a lot of you. I believe most of our new municipalities this year are considered small groups. So just know you already have that service in place. So any members that are new to joining health insurance will get new letters. Anyone who leaves the coverage or employment will be issued a letter if they're leaving the health insurance. So if your name's on the list, you're one of my small groups. The other thing that the consortium has is size, right? So 87 municipalities, we cover over 8,500 lives. We're a big group, which means we have some negotiation power. So one of the things that we were able to do is we reached out to Lifetime Benefit Solutions, and they were all able to offer us discounted pricing for our municipal members. So let's say that you currently have a high deductible health plan you're offering your employees, and you match it, you have it with an HRA, a health reimbursement account. Make sure that what you're spending on administrative services for that HRA are equal to or better than what the rates are through LBS, because it could be saving you more money. And if you want the full rate sheet, because they offer a lot more services than just an FSA and an HRA, we can definitely send out those rate sheets. But this is a great way to save our municipalities a little extra money, especially for our small group. You know, it's a lot cheaper to pay per enrolled. Some of the small groups I've talked to, they're paying, you know, $150 a month for their HRA administrative service because they don't meet the minimum amount of people on it. So this might be a great way to save some extra money just by being a consortium member. The other service that we've negotiated a large group rate for is EAP services, so Employee Assistance Program. This is not embedded in your health insurance. You would have to directly contract with Total EAP and pay them directly for the service. But the pricing right now is at $18.19 per employee per year.
Per year, Kylie?
Per year. Which honestly, like, I know I talked to some small groups last year and they don't have enough employees. So they were paying, they were quoted around $2,500 a year flat rate because they didn't have enough employees. Whether you have 1 employee, whether you have 25, whether you have 200, that's your rate. Just by mentioning that you're a member of the consortium. So if you need contact information for that, I can connect you with Total Care EAP. A lot of our larger municipalities offer this service, and I've heard nothing but great things about them. So a lot of people, when I say EAP, they're like, oh, that's that mental health thing where they can call a couple times a year. Total Care EAP does a lot more than that. They not only offer mental health for people in crisis, which is important to offer all your employees, but they also offer things like financial planning, caregiving support, childcare support. One of my examples I always use is I reached out to them and be like, tell me all of the day camps that are available in the summer that I can ship my kids off to. And they emailed me a whole list of day camps within a 30-mile radius of where I live. So they do a lot more than just mental health service. So definitely a great service. Okay.
All right, thanks for using the chat. We will make note and send that information to you. And that's just a good reminder. If you do have questions, you know, unmute yourself, ask the question. We'll pause in a little bit for questions, but also use that chat feature as well. And Kylie, you're gonna have to speed up.
Okay, going fast. Sorry. We don't offer dental directly, but we work with CSEA Dental to offer their dental plans, which yes, are a little bit more pricey than Excelis plans and things like that, but they do cover more. So the Duchess Dental, and as you can see, those prices are a little higher. They cover adult braces as well as pediatric braces. They cover 3 cleanings a year instead of 2. The other option, the EBF choice, costs a little less per member per year, but they don't cover adult braces, so it has a slight decrease in those benefits. And they have a great network across all of the consortium municipalities. So we can, of course, connect you, or you can connect yourself. Just be sure to mention that you're a consortium member, to get the gold treatment there. As well as CSEA Vision is also an option. We get asked this a lot, you know, do you offer vision? All of our metal level plans include vision coverage, includes a routine eye exam, and includes adult eyewear, $100 allowable, but maybe you're looking for something a little bit more for your members. This is another great option to look into for offering vision health insurance. But keep in mind too, if you already offer Excellus Vision, you can keep that and still remain with a consortium. These aren't mandatory, these are just options. So I'm not going to go line by line like I normally would when it comes to plan options. I just wanted to make you aware of what we currently offer to new municipal members. So we have currently 4, and you'll pick up on why I'm saying currently in a minute. We have 4 metal level plans: platinum, gold, silver, bronze. The gold, silver, and bronze are high deductible health plans. And we also offer 2 Medicare supplement plans, the MS3 and the MS4. Their main difference is difference in copays for medications. Like I said, I'm not going to read this to you. It is on our website if you want to blow it up and make it bigger to read all the tiny print. But it does document kind of where our platinum, gold, and silver, bronze copays, deductibles, and all of their rates. And then also that we have retiree plans as well. Our Medicare supplement plans pick up everything after Medicare. They pick up the Part A deductible, Part B deductible and coinsurance. Anything that Medicare covers, our Medicare supplement plans pick up the balances on. And new to us, we're on the verge of DFS approving 2 new plans for us to be offered. A gold hybrid and a silver hybrid plan. Hybrid plans combine copays and deductibles into one health insurance plan. So as you see, like under the gold hybrid, deductible is a little less than our standard gold. And then certain benefits don't have the deductible apply. You only have a copay to pay, which will be going towards your deductible. So a little bit different. I'm hoping to do an education session later on this year to talk about our hybrids and review their benefits. The other thing that we always talk about, we talk about an executive committee and the board, and I don't know, everywhere, is,
Are we competitive?
yeah, what are your rates? Are they really that much better than Excellus? So we took plans that Excellus offers that are benefit comparable to our plans and then compared the rates. So as you can see, our platinum, gold, and silver and bronze plan for single coverage are a little bit less than Excellus, but where we really show the savings is our family rates, where just for example, on our platinum plan, our family rate is almost $1,000 less than the Excellus platinum rate. So yes, we are very competitive in our community rated plans against Excellus. We compare against Excellus because that's what's most similar to our plans. When we compare outside of Excellus, the savings just increases typically.
So before we switch to Jen to talk about billing and invoicing, just want to ask if there's any questions. Pause for a second. If not, we'll pause again after the billing piece. And like I said, you know, most people know how to pay bills. Ours is just a little more complicated. We can explain why we do things the way we do them. Right, Jen?
Yeah, absolutely. For those that may have popped in a little late, I am Jen Samstead. I am the finance manager here at the consortium. I'm just going to go through billing, some examples and how we do things a little bit different. Enrollment changes entered by the municipality or the consortium if you're a small group, and processed by Excelis by the 12th of the month. They will appear on the Excelis reports that I run for billing on the municipality. So we bill in full months only, so when you enter your terminations, make sure that you date those for the last day of the month. You don't want to use the first day of the following month, because you'll be billed for that entire month. And to ensure timely payment, we bill municipal partners 2 months in advance. We do get a lot of questions on why. This allows municipalities that process invoices through their abstract sufficient time to remit payment by the due date. Late payments do incur a late fee. It is a 1% fee from your total invoice. I'm gonna go through some examples, because I know it can be confusing, if you see some retroactive adjustments on your invoices and why you're not seeing some on one, but you may see some on the others. So the first new municipal member bill that you get, the consortium has generated a bill based off the enrollment census. The bill is sent mid-November with a due date of December 31st. The bill will include your January 2027 premiums. Second example, Tom Jones is hired February 1st, 2026. His enrollment form is entered prior to that February 12th cutoff date. The Excelis report run by me happens on the 14th of the month. Invoice produced in February for the municipality is for April with a due date of March 31st. There will be a retroactive adjustment for 2 months on that invoice for February and March, because this is April's bill. So at the very bottom, you're gonna see a retroactive adjustment for those 2 months. Another example, Anita Baker is hired May 1st, 2026. The enrollment form is entered June 16th with an effective date of coverage of May 1st. Excelis report run by the consortium takes place on May 14th. Invoice produced for the municipality for July with a due date of June 30th will not have Anita Baker on it. Excelis report run by the consortium on June 14th. Invoice produced for the municipality for August with a due date of July 31st will not have Anita Baker on it. Excelis report run by the consortium on July 14th, 2026. Invoice produced for the municipality for September 2026 with a due date of August 31st will have a retroactive adjustment added for 4 months, May, June, July, and August. And when you see your bill, that first one, you're gonna ask, why is Anita Baker not on it? And that was why, it was because that enrollment was entered after that cutoff date and far after that cutoff date. So you want to make sure you get them in as soon as you possibly can. You're not going to see that retroactive adjustment.
If I could just jump in for a second. One of the reasons we do things this way, first of all, we bill in advance because the municipalities asked us to, so it could go through your abstract process. So you have at least a month to get it on an agenda and approve it and get your check into us before the beginning of the month that premium is for. But the other reason why we can't make retroactives on the fly is we are also paying a administrative bill to Excelis, and we have 8,500 contracts out there with employees and family members. And we cannot manage the Excelis invoice, so we have to pay according to that invoice. And then we couple it with doing it 2 months early. So there's a lot of behind the scenes that we can't Mickey Mouse around with. And that's why we're doing it that way. We're not trying to be difficult. But I will stress that getting your enrollment into the system, whether you're sending it to us through the portal or you're doing your own data entry on time, is very important. we'll not go through all our policies on if you wait a year and send it to us, what happens? But it really helps with you understanding the invoicing, but more importantly, us understanding how we're invoicing you if those enrollment forms are in on time.
Yes. So the next slide that you're gonna hear me say a couple of different times, and some of you may have received an email from me. We are switching to ACH. Being you send your payment via ACH to us. I will not be going in and taking money out of your bank accounts, so don't worry about that. Why ACH? Many reasons. Payments are faster, typically processed within 1 to 2 business days. It's reliable and secure. No risk of the checks being lost or delayed in the mail. Not sure about you guys, but we have had many checks show up a month or 2 after they've been sent. So we don't want to have to rely on the mail person and if they can get those checks to us or not, because it'll ultimately fall back on the municipality. If we don't get that check in time, you're gonna get hit with a late fee, and I don't want you to get hit with a late fee. Simplified process. It's easy to set up. If you have any questions, I'm happy to help walk you through it. And they will be mandatory by June of this year. So get thinking about it. Call me with any questions. Again, I'm happy to help walk you through it. And here's all my information on how you can get in contact with me. So
How many checks do you write, Jen, in doing business for the consortium? You have to pay a lot of different resources.
So I pay a lot of bills during the month, and when I first started, I think last year, I printed 2 checks. And that was it. Everything else I have set up via ACH or wire. I know it can be scary at first, but it is so convenient. It's so easy. It's so quick. It's really nice. It is, change is scary, but it is really nice to do it and not worry if that check made it in time, and worrying about late fees, so.
Yeah, and some
I
of
cut no checks.
some of your vendors have required this.
Oh,
as
yes,
well.
multiple vendors have required, and that is the way of the future. A lot of people are making it a requirement now, so not trying to be a bad guy, we're just, it's what's happening in the world. This next slide is an example of a roster that you will see attached to your invoice. So invoices and rosters will be sent directly out of QuickBooks. This is what I get from Excelis. I do manipulate the spreadsheet a little bit to make it a little bit easier to read with the information. Always look at your roster and compare it to your invoice. I am human. I do make mistakes. You can call me out on it. It's fine. I won't be mad at you. Anything in the contract type that is a 1 stands for or individual. Anything that is not a 1 is family. They're all broken out by plan, and I do a total at the bottom of it to say you have 50 individual and 45 family to make it a little easier. But always please double check that work. If you find somebody's missing or not yet terminated, please verify that you've submitted the change either through the consortium or through Excelis. Again, process terminations and changes as soon as you know them. Backdated terminations will only be reimbursed back up to 120 days. So keep that in mind as well. Also, please don't ever short pay your monthly bill. If you think that there is something wrong with it, most likely it's going to be a retroactive adjustment that will show up on a future bill. Reach out to me with any questions. I'm happy to go over it with you, but you will most likely see that retroactive adjustment in a future bill. Okay, another billing tip. An employee and their spouse should be enrolled in family coverage, not 2 individual single coverage plans. Medicare supplement plans are the exception. If the spouse is also an employee, then they can each have an individual plan enrollment. Again, ACH, we have it, it's already set up, it will be mandatory by June of this year. Excellus billing rosters are pulled the 14th of every month. Depending if there's a holiday in there, it may be a day or two after. Therefore, submitting enrollment changes before this date will ensure a more accurate billing. If you have any questions or any issues, you can email me, you can call me, I'm here to help. That is it for billing. Does anyone have any questions? This is our updated address. If you do need to send anything via mail, some people had a PO box. We are closing that down. That is on your invoice it will be on it for a little while. Please do not use the PO box anymore. If you need to mail anything to us, please use this address. I think I'm gonna turn it back over to Elin.
Yeah, so just, we've come through the first, we're pretty much on time, thank you. So we have covered the director portion, of the presentations today. We're gonna dive, into some very specific information on health insurance, administering the plan, enrollment within the plan. So I know some individuals who aren't involved in the details may want to jump out at this point. That's perfectly fine. But if you really want to know more about the consortium and an administration of the benefits within the consortium, Kylie is going to be covering that presentation that we also share a lot with benefit clerks will be the next hour. So I'll pause right this second for any questions. If any of you are leaving and have a question, I know we have the one chat requesting information, which we will get to you. So I think unless anybody unmutes themselves, we're probably good. So any of you who do exit, I want to thank you for coming and learning more about the consortium. And this is a cooperative health insurance organization. So we're thrilled to have you as part of the cooperative, and we look forward to cooperating with you as well. Thank you, cheers, Kylie.
Okey-dokey. So feel free to interrupt, unmute, throw things in the chat as you have questions. I don't want you to wait till the end to ask them. Because sometimes it might be 3-4 slides later and you might forget what you wanted to ask. So you're not interrupting if you have questions. I did want to take a few minutes to kind of provide an overview of how the health insurance works. So we are the consortium. We do write our own plans. But we do contract with Excellus to manage those plans for us, which means all medical and prescription claims go to Excellus. That's why on your subscriber ID cards, it'll say Excellus. You'll also see our logo in very little print. The consortium plans all use the same drug formulary, which what that means is if you are on a platinum plan and you take a tier 1 medication, that medication is still going to be a tier 1 medication if you're on the bronze plan. All of them have the same drug formulary, which means how they rank the medications. We also have what's called an open formulary. So a lot of the community rated plans have what's called a closed formulary. Open formulary means we cover all the medications, but there might be certain prior authorization requirements, step therapy, quantity limits, and the tier category may change. But we do cover all medications in our open formulary, where a closed formulary says, okay, we'll cover this drug in this category, but we're not going to cover the other one. So they have to cover at least one medication in each category, but they don't have to cover them all. So it actually is a great benefit to our members to help them seek out the treatment they need. All consortium plans have 3 tiers. Tier 1 is being the least expensive copay. Tier 3 is being the highest copay. So sometimes when we have members call saying, I just had to pay $70 for my new medication, That means you got a tier 3 medication on the platinum plan. And it doesn't hurt to have a conversation with your doctor about, are there alternate medications that might be a little less expensive for them? You know, of course, we don't replace doctors, but we like having those conversations because sometimes people won't be in compliance if they're on an expensive medication that they can't afford. So having those conversations. All of our plans also have access to 2 mail order pharmacies. Now, I don't know why, but Express Scripts won the luck of being the mail order pharmacy on the back of the ID cards, but you actually have access to 2. So it's Express Scripts or Wegmans home delivery. You don't have to be getting your medications at a retail Wegmans pharmacy in order to sign up for Wegmans home delivery. Both work very well. Both have websites and you can go and you can reorder your medications. The mail order pharmacies send a 90-day supply of medications directly to the member. And the copay rates are normally discounted where you only pay 2 months of copays instead of 3 for the 90-day supply. But between the 2, I always recommend Wegmans home delivery, just because it seems like they have less of an automated system. If you have tech savvy people, Express Scripts is great. I work with a lot of retirees who like to call me and they like the Wegmans home delivery a little bit better. To each their own, they work the same. The claims cost us the same, but I just want to make you aware they do have options. We also do not mandate mail order. So if they're on a maintenance medication they get every month, they can keep getting that at their retail pharmacy. This is just a convenient way to get the meds shipped right to your home at a 90-day supply. So the useful links slide here comes out of me working with our members. These are frequently asked questions from either our members or our benefit clerks. How do I know if my doctor's in network? Excelis actually has a find a doctor tool on their website. You can either log into your individual Excelis account. I always use it as a guest. And you can search doctors. I have a lot of members who have dependents who are away at college and they have no idea where to send them. And so they can go in and put in the zip code to the college and search for providers that are around them. Search for an urgent care, search for a primary care doctor. This is a great tool to have. And when you're sent the slide deck, all of these are live hyperlinks in the document where you can click on these and save them to your favorites on your webpage. MD Live is available on all of our plans, our meta level plans, and it's telehealth. It gives our members 24/7 access to a doctor. You have to register either on their website or on the app. It's very easy. I say that and I tried to do it online and couldn't. I called their customer service and they had me signed up in 5 minutes. So, I mean, even I, even I can handle 5 minutes with customer service. But you can hop on, like if you're sick and you're looking for antibiotics, you can hop on at 2 in the morning and meet with a doctor within 5 to 10 minutes. They can write a script, send it to your local pharmacy, and you can pick it up when the pharmacy opens in the morning. This is a great tool for those staff that you have that might have kids. Kids never get sick when it's convenient. You know, Sunday night, 8 o'clock, your only option is the ER. There isn't an urgent care open. This is an alternative to that. Obviously, if you have broken bones, if you're unconscious, please do not use MD Live, go to the ER, but this is a great resource and it works both ways, right? So MD Live is a 0 copay under the Platinum plan. So it doesn't cost our members anything to use it. And it helps us out because most people who use MD Live would have gone to an urgent care instead. The difference in that bill is hundreds of dollars to us in claims. We keep claims low, we keep premiums low. So we all work together on this. The other big thing with MD Live is it offers behavioral health appointments. So if you have an employee who says, you know, I can't get an appointment anywhere, they're putting me on waiting lists. MD Live is a great solution if they're willing to do virtual appointments. You can meet and chat with them face-to-face virtually. You can do it over the phone. You can be scheduled with the same provider, so there's consistency of care. We've seen a huge uptick in behavioral health usage for MD Live in the last year, which means it's being used and it's supporting our members, which is important. WellFrame is another free service that you get access through by being a member. Wellframe is an app that you download on your phone, and you can have access to dedicated care team. They can text you, they can message you. You can sign up for programs like weight loss. Or if you have a chronic disease, this is a great resource to have dietitians and nurses at your fingertips to ask questions. I just got put on insulin. What does that mean? Or I'm struggling to do this. Or handle this or understand it. You know, we can't all think of those questions when we're sitting in front of a doctor. Wellframe is a great resource for our members. As well as Excelis offers Blue 365 deals. If you're not familiar, check out the website. You log in using your Excelis ID number and you get access to a whole bunch of discounts. So the discounts range from eyeglass discounts, sneaker discounts, very handy for Christmas shopping, by the way. Or even gym memberships. So a lot of our local gyms here, as well as other areas, participate in the gym discounts that are available through Blue 365. So definitely worth checking out these links and sharing them with your staff. So one of the things that we tend to talk about, what's happening? Where are you going?
Do you want me to go back to this one?
No, you're good. Next one's fine. No, not that one.
Next one?
Next.
Sorry.
Okay, you're okay. One of the things that Jess and I feel like we talk about every day with benefit clerks is enrollment. So we're gonna provide an overview of who qualifies to be enrolled in our health insurance, how to enroll them, how to fill out an enrollment form. And it's okay if you have questions on this, you can always reach out to us while you're filling out the form. You know, we might reach out to you if we're missing parts of the form. So who can be covered by the plan? Employees, employees' spouses, also employees' domestic partners. We do leave it up to each of our municipal members to decide if they want to offer domestic partner coverage. We offer it with all of our plans, but we do understand it's an additional expense to our municipal members. So it's up to you if you want to offer that to your employees or not. We have some that opt not to, and most do, but that's entirely up to you. We also will cover dependents, which include children, natural, adopted, stepchildren, and even domestic partner children. That's who can be covered. So I think a couple weeks ago I was asked, okay, well, I just had a grandchild and they need health insurance. So can I just add them to my plan? Unless they are legally part of your family unit, which means they're a dependent of you, you cannot add them to the plan. You can't add them just because you have good health insurance and you want to cover your grandkid. The same goes with if you have a staff member that goes through a divorce, and they should have ended coverage for their ex-spouse, but they want to keep the plan because they want to keep covering their ex-stepchildren, they don't qualify anymore for health insurance. They should be removed from the plan. Good maintenance of our enrollment means that we're not paying on claims we shouldn't. And this is gonna come up at our benefit clerk training, but we are going to be doing a dependent audit in 2027, which is double checking to make sure that everyone on our plan should be on our plan. It's not as scary as it sounds. So how do you make changes? You have to verify the information you're putting on the enrollment form is accurate and true, which means getting birth certificates. It means getting a marriage license if they're saying it's their spouse. That is documentation we rely on the municipalities to obtain. It's not documentation that the consortium needs. All we need from you is a completed enrollment form submitted through our enrollment form portal, or if you're a large group, entering that information into the Excelis website. We don't need all this supporting documentation, but it's important that you obtain it to make sure that they do qualify to be on the health insurance. So small group, 50 or less, would submit their enrollment forms to our enrollment form portal. Why is that so hard for me to say? Which is on our website, and I'll show you how to get there. If you forget where it is, which we do get at least one email a week about, now where's that portal? Because let's face it, you don't have a lot of turnover, which is great. So you may not be looking for this until 6 months from now. So feel free to reach out with those questions. Everything can be found on our website, which is www.healthconsortium.net. If you're a large group and doing your own data entry, it would be the excelisbcbs.com and logging in through your employer account with them. So this is the landing page of our website. We just redid this website from top to bottom, reorganized it, made it more accessible. Thing of beauty, I tell you. So I'll show you where to navigate to get to the portal as well as the forms that you will need for enrollment. So on our main screen, you'll see tabs at the top. You would go to the employer tab and then it generate a drop-down menu just by hovering over it. And then in there, it says enrollment portal and enrollment forms by municipality. Yes, each one of you has your own individual enrollment form that we've generated and we post to our website. Once you click into there, you'll see number 2 here is kind of what the landing page looks like. Up at the top, it says enrollment form portal. That will link you to the portal. If you're looking for your clean copies of your enrollment form, you can scroll down. It lists all 87 members. Each has their own individual enrollment form specific to the plans that you offer your employees. You can click the link. All of them should be fillable PDFs. So if you want to just cut and paste the link in an email to a new employee to enroll, you can do that. Or you can print them out and hand them to them. Either way, they do need to be signed. So at some point they're going to have to be printed, but these are where you would find your enrollment forms to process an enrollment and or a termination or changes.
And Kylie, if I can just barge in here, the portal is really important. We try to protect, we have policies, we have procedures to protect not only personal health information, but just PI, personal information. Faxing a form, just flat out emailing a form, emailing us with an employee's birth date and social security number or subscriber number and birth date. That's all PI information that we shouldn't be sending just willy-nilly through email. The portal is a safe way for you to submit information to us. And that's, you'll find that we will continually push and mention the portal, and it's really to protect all that information.
Just to tack onto that, you'll notice too that when we will send you a confirmation that it's been processed, that's going to be an encrypted email because of that. So if you're struggling to open the encrypted emails, let us know, because you've been put into an HC benefits group for us, so you can open those encrypted emails. If you haven't clicked accept and all that, I can send a new invitation. But a lot of what we send will be encrypted to protect not only you, protect us, and protect your staff from having any of that information stolen. The way that the portal works is you're actually uploading it, which then we get an email notification and we go to the protected area to pull that form. So we're doing as much as we can on our end to protect everyone involved for submitting that information. So first, once you get the completed form, which we'll go over how to complete one, you're going to make sure to scan that and save that on your end, because when you get to the enrollment form portal, there'll be a quick form for you to fill out with your contact information as the benefit clerk. And then you're going to attach the scanned copy of the enrollment form, and that's what you're submitting to us. It's important to fill out the contact information, because if we have any questions, we need to know who we're reaching out to, who's submitting it. So just something to keep in mind. So this is kind of like the beginning section of an enrollment form. Each enrollment form, like I said, is individual, so it'll have your own group number on it. It'll list the medical plans that you offer your employees. It's always important, if you're handing a form to an employee, when it comes back to you, make sure you're double checking it. I can't tell you the amount of times that I have to call and say, was that an X or a Y? Was that a 1 or a 7? because they're scribbling it on there because they're assuming you know the information, but it's coming to me who's never looked at any of their information. So just reading it through and making sure everything is legible, and also making sure that you're hitting all the key points that we're gonna go over on the form and that it's filled out. If we get incomplete forms, we'll email you, we'll call you, we'll ask questions. But while we're asking those questions, it means they're not enrolled yet. It will slow down that enrollment process, the more questions we have to reach out with. Right. So section number 1 that's up here, is where you're gonna tell us if it's single or family coverage. It's where you're gonna tell us if they're actively working, it means they're an employee who's working. If they're retired, it means they worked for you and now they're retired. If they're canceled, it means you're ending their coverage. And for COBRA, it means that they want COBRA coverage. You wouldn't fill this out unless you were a large group, small group, everything is canceled and we take care of the COBRA on the back end. So, the circles. The red circles are a must. They need to be completed, which means under group administrator signature, that's where the benefit clerk should be signing and dating every enrollment form. That's telling us that the municipality is aware of this enrollment. I actually had a highway supervisor email me an enrollment form for one of his new hires to speed up the process of enrolling them in health insurance. I was like, that's not how any of this works. You have to talk to your clerk who has to say, yes, they're eligible to enroll in health insurance. You got all the documentation. Like there's a process to it. You can't just bypass everybody at work. You also want to check the desired action. Adding means that they're either adding a dependent or adding themselves as a new hire. Canceling means they're terming coverage. Change means they're making changes to their coverage. The other piece is making sure you're checking what plan they're enrolling in. Again, even if you're only offering one plan, you should still be checking the box because this is your proof that they elected that plan. They signed up for it. They checked it off that that's the plan they're picking. The form works both ways. It supports you documenting what they're doing and it supports us documenting what you're telling us to do. The bluish purple circle, don't know what happened there. That's if you offer multiple plans. We have some municipalities that actually designate subgroups by union group. So if that's the case, we really need that information to know. You might offer platinum, but have 4 different subgroups because you have a CSEA union, a DPW. We need to know which one you want them to be put into. So that's an optional one. Okay. Section 2 is where we learn about the subscriber, the employee. You're going to make sure you're filling in their first, their last name, middle initial. We definitely need date of birth, gender, social security number, date of hire. If they're switching from active to retired, we need the retirement date. Address is important. So is phone number. If they have Medicare, we need you to put that information in there, even if they're an active employee, because that's what sets up coordination of benefits. So just checking this and making sure we have all the information. So section 3, if you're enrolling a new hire, you would just check new hire. This is also where, if it's outside of being a new hire or open enrollment, you would check what special enrollment opportunity are they qualifying for to add or remove people? Did they have a new baby? Did they get married? Did they get divorced? Did their employment status change from part-time to full-time? So now they're eligible for health insurance. Were they covered under their spouse who just lost their job? So now they have involuntary loss of coverage. You know, things like that are important to document. We will need that to process any changes outside of new hire and open enrollment. Go back real quick. The COBRA section on this, you would not complete if you were a small group, which is something to keep in mind. If you have address changes, I down at the bottom, demographic change, address change. You can just email those to us with the member's name and we'll find them. And we can update their address. I don't need you to fill out a 5-page form to tell me they had an address change. Go ahead. So section 4, it's for canceling. It's not for enrolling. You can cancel. If you cancel the subscriber, you cancel all the dependents. So that would be the first part. Maybe they just have dependents they're removing. You know, we divorced, I want to remove my ex-spouse. They would put their name, the cancel code, and when they want it to end. Remember, ending at the end of a month, not ending at the beginning of a month. If you end at the beginning of a month, you pay for the month, whether it's for a day or 2 days. And the cancel codes are kind of a requirement. We can't process without them. So then section 5 is where you add information about the spouse, domestic partner, dependent children. You're going to want to make sure to include their last name, first name. I know it says last name if different. I just like it if you could just write their last name, because in this day and age, everyone has different last names, I feel like, and then we're sending them in cards that don't match their actual name. So it's just easier if you fill it in, making sure we have to have social security numbers, we have to have dates of birth, we have to have gender. You know, if they have other coverage, we need to know about it. I do have some subscribers who have really big families, 5, 6, 7 children. It's okay if you just print this one page with the 2 dependents and add it to the enrollment form to make enough dependent slots. You don't have to fill out a whole new section 1 and 2 every time to add more dependents. Section 6 only needs to be filled out if they're keeping coverage. So let's say they left their last job, they're canceling their health insurance with their last job, and you're hiring them. I don't need to know about that last job's health insurance. But if they're keeping coverage, so let's say their spouse covers them under their work insurance, and now they're picking up your insurance too, I need to know about the spouse's work insurance that they're covered under, because that's how we set up coordination of benefits. What is coordination of benefits? That's who pays first. So in this case, in the example, if it's covered under the spouse, the consortium coverage would pay first for your employee and the spouse's coverage would pay second. But if it was flipped around and let's say they're covering their spouse, this coverage would pay second for the spouse. So it's setting that up to who pays first to make sure that we're paying on the claims we should be paying on as primary, and that we're paying secondary on the claims that we should. It's important on the back end of how much we're spending on claims. And you need to make sure that the employee is signing. So this is the last section of the form, section 7. That this is your documentation saying, yes, I'm enrolling in health insurance. Yes, it's okay that I'm paying for my health insurance. This is the documentation that's supporting all of that. If they're not signing it, then you don't have proof that they agreed to it. This also goes for if they were offered retiree coverage and they didn't accept it, you should make sure that they're signing it. The only time that we see this go unsigned is, let's say you have an employee, and I don't wish this on you, but they just stop showing up to work. It's pretty hard to get them to sign a form when they're not even showing up to work or an employee any longer. We understand that not all terminations can result in a signature, but if it's a planned leave, try to have them sign this form that is terminating their coverage. If they're enrolling in a new plan, they need to sign it. If they're a new hire and they're adding coverage, they need to sign it. So it's important to make sure that they're signing and dating that as well. If we get new enrollments without a signature, we'll ask you to get a signature and we'll put the enrollment on hold until we get one. This is the quick review, because I just said a lot of words for filling out a form. This is the 1, 2, 3, 4, right? So you're gonna get that enrollment form completed. You're gonna scan it to your computer. You're gonna then open the enrollment form portal, and you're gonna fill out that form, upload that PDF of the enrollment form, and then you're gonna send it to us. When we get it, we will process the enrollment. And then we will send you back a confirmation via email, and it'll have a document you can print and put in their file that documents that they were enrolled. It says 3 business days. I think on average, it takes us about an hour.
As long as we have all the information.
As long as we have all the, yes, Jess. You can tell who'll be emailing you. As long as we have all the information on the form, it takes us about an hour to process an enrollment. And Jen mentioned earlier about backdating effective dates. Yes, we can. Do we like doing it? No. Because all that winds up happening is, oh, well, I had to self-pay for my meds and now those claims need to be submitted to health insurance. Or, oh, I went to the doctor and I didn't have my card, so now that doctor has to resubmit claims. It's very messy for our subscribers who don't have a card when the coverage is effective. You can make coverage effective the date of hire, but keep in mind, you're still gonna get billed for the whole month. So if they were hired on February 28th and you want them effective February 28th, you're gonna pay for all of February, even though they only had coverage for 1 day. So we normally encourage municipalities to start on the 1st. Some unions have their own contract. Insurance starts date of hire, that's okay. But just something to keep in mind. The other thing that you may see from us from time to time from the benefits department is age notifications. Excella sends us these letters, and yes, most of the personal information is like blocked out. But it tells us when members, one, are either aging off at age 26, any dependent who's covered under health insurance who is turning 26 has their coverage turned. At the end of the month, they turn 26. We'll send you a notice. We want you to make sure that you're talking to your employee about it. They also get a letter, but our subscribers aren't great at looking at the mail. We want to make sure they're aware of it, that their dependent is losing coverage. The other one is when they're turning 65. So if they're actively working, we may ask you, are they picking up Medicare? If so, they're going to need to fill out a form that's going to be directly mailed to them. If they're retirees and they're picking up Medicare at age 65, we're going to need their Medicare information if they're staying on retiree coverage, because Medicare always pays first in retirement and we pay second, as long as they have Medicare. For a large group, it means you have to go in and manually move them from under 65 to over 65. Of course, if you have any questions when you get these notices, just let us know.
It also triggers COBRA.
Yes, for the aging off at 26, they'll automatically be done. It automatically turns. You don't have to send us another enrollment form, and then it'll trigger COBRA for the dependent to see if they want to keep that single coverage at the full cost of the plan per month. Active versus retiree class. I just had this conversation with one of our municipalities. Well, I just thought I'd leave them there. No. So if you have an employee who is active and they retire, you have to submit an enrollment form so we can move them from active class to retiree class. Why does it matter? Because if they stay in active class, we pay as primary on claims. Even if they're retired and they pick up a second job where they have other health insurance through that really should be paying as primary. Or they have other coverage in retirement like Medicare, moving them to retiree class is what sets up that coordination of benefits so it's paying correctly. So if you have someone who's active and they're staying on coverage as a retiree, we need an enrollment form to tell us to move them to the retiree class. It's an important step of what we do. I know it means more paperwork, and you want to make sure that that retiree is signing off on that they're aware that they're remaining on coverage. Document. Municipality world, that's the key to everything. But it's important to do that. Our website, it really gives you such a wealth of information. You can't hurt it, okay? You can't accidentally click on something and the whole world ends. Please feel free to go around our website and look at everything. We have benefit plan enrollment forms there. We have the portal. We also have benefit summaries. We have our premium rates up there. We have agendas, minutes. If you want to look into our committees and see what we're all about, this is a great way to do it. We also have a YouTube channel. We post a lot of our trainings there as well as our wellness, if you want to check it out. Oh, 1 second. I got a question in the chat. What if the person is retiring but not picking up coverage from any place else as they do not qualify for Medicare yet? So if the person is retiring and staying on coverage through your municipality, you would still need to complete an enrollment form to move them to the R class. If they're totally leaving your coverage, we would still need an enrollment form to turn them off of coverage. Yep, no problem. We also, on our website, we have a calendar of upcoming meetings, trainings. We have a wellness landing page if you want to see the flyers for our upcoming events. Financial reports. We post our newsletter there as well as we'll email it out quarterly. Just really a wealth of information on our website. So please feel free to check it out. I like to plan ahead. Does anyone in the office?
No, but
Tell you. So I figured it wouldn't hurt to put some upcoming meetings on your calendars to give you a heads up. You are the first to hear about our upcoming spring benefit clerk training. I don't even know if I've told Elin yet. That's April 1st. It's virtual. You don't need to come in person. But we plan on doing case studies. So talking about some of the common things we see or we're getting phone calls about that we want to talk to you about. As well as I wanted to include the joint committee meetings because there are only 4 meetings a year. They kick off in May, so you have some time to make sure you have those joint committee representatives sent to Lynn so she knows about it to send you the committee meeting invite. But to give you a heads up, our May 7th joint committee meeting will be talking all about utilization management and our plans for 2025. So really great information to just look at how our plans are getting used and how they're benefiting our members. And then of course, our board meetings, August 27th is virtual. August 24th, we get to see all your smiley, happy faces in person for our big meeting. So just wanted to give you a heads up.
Oh, and I didn't mention that earlier. We are considered under municipal law meetings law, GML. And so when we vote, we have to have in-person quorum. So that's why we request your presence in person. We try to lure you there with lunch. Some say we should serve drinks. I don't know. I don't know how anyone would appreciate your premium pricing going towards serving alcohol. So we've stayed away from that. But that's why we require in-person attendance. Both the executive committee and the board have that in-person quorum requirement.
So when I normally go out to on-sites, this is the one where I say, and you're always going to get a human. This is us. These are our direct phone lines. These are our direct emails. We're not shy about you reaching out to us if you have questions or concerns. And even if you call the wrong person, we will get you to the right one. I know I get a lot of billing questions that I send to Jen and she gets benefit questions that come to me. So this is our full staff. We are small, but we are mighty, as Elin says. So we're here to support you and what your municipality needs. So we want to be as transparent as possible. You're welcome to reach out to us anytime you need anything.
Awesome. Thank you, Kylie. We'll pause here for a second to see if there's any questions in the chat or elsewhere. I want to say how shocked and surprised I am. I don't think Kylie has ever finished early. So great job.
Just because normally I get more questions. That's all.
All right, I don't see any hands popping up or anyone jumping on the screen. So I'd like to say thank you to all of you for your time and engagement today. The strength of our consortium lies in collaboration, and your role is essential in helping us deliver those quality health benefits to all our members. As I quoted Helen Keller earlier, together we can do so much. So we look forward to working with you and supporting your teams. Don't hesitate to reach out to any of us. That's why we give you that contact information. But with questions, not just with questions, but with ideas, we add to our plans, change our plans because of ideas from you. Our success is built on open communication and shared commitment. So thank you so much for joining us today.